great. So I'm Dr. Briseida. I have a MD PhD from America. I am originally from Albania. I moved to America in 2005. I do have a training in psychiatry. So I worked as a doctor assistant in psychiatry in New York for 5 years, and that happened during COVID. I still work with them. So whoever needs an appointment that you guys live in America and you need an appointment with the best psychiatrist, he's a 3 times board certified psychiatry, neurology, and addiction. So any help in that area, you can reach out. Um, I'm also a professor in medical school, and currently I'm actually on vacation in Albania, and then I travel back to America because I do come back and forth a lot. I'm constantly moving. I also work for a company for weight loss. It's called SNAP. It's based in Italy, but they do serve, everywhere in Europe, and it's 100% organic. It's very good for those of you who want to work from home, but you have to be in Albania, like within Europe, because you need a bank account in Europe to work. So I am here to help you with all the information that you need about healthcare, insurance, meetings, anything else that, since I've been in America for 20 years, but I am Albanian, so I know both worlds. I'm sure some of you maybe are already in Albania or are thinking to come to Albania. I'm not too sure, but I would like to know a little bit who I'm talking to, and then we get into the questions.
So I know at least one of well, besides me, Anastasia, she just moved here from the US, and I believe the others are looking into it.
Okay, great. So it will be one of the best decisions of your life, just because I left Albania about 20 years ago and has changed. It's more beautiful now. It's safer. I mean, I love America, and America, it's my home, of course, but there is a lot of things that when you come to Albania, you understand why is a good move. Let me put it that way. So I am considering moving here myself, but for now I just spend half a time in Albania, half a time in America, just because the transition, it's not easy for everybody, especially if you have kids in school or other obligations there. I'm divorced, so other parent has to see the kid and those kind of things. But for single people and people that are with a family, they can make a decision. For them, it's easier to move. I'm grateful to Sarah, and has been a pleasure since I met her, for being a help, because anywhere you go to a new country, you kind of need you need the advice, you need the guide, right? Because we want you to have the best information, and we want you to have a smooth transition. So today mainly is going to be about healthcare. I'm also a psychologist and I do therapy. So whoever needs, sorry, it's so whoever needs the private mentoring, or therapy session or anything else, you can reach out to me, reach out to Sarah. We can make appointment for private session, one-to-one. But today we're going to try to answer as many questions as we can, cover as much as we can, and we can have another session like once a month or once in 2 months, of course, with more information. Just today I only have 1 hour time because I'm booked back to back. So we can start with the questions. I did try to get two phones so I can use my other phone.
Okay, we've
With
got
the
more
first one
people
that is
joining.
the Okay, great. Yeah. So I'm going to send you my resume. You can share with all of them so they have an idea of my education, my background, who I am. And also my resume, they do have my email, WhatsApp number, so they can, contact me directly. I advise everybody to Hey Alda, I'm in the meeting. Can I call you back? I'm in the meeting right now. Bye. Jesus, like 5 times calling me. Somebody died? Sorry about that. Okay. Let's jump into the first. Okay, should I go over medications first? I think that's more important.
Yeah, yeah, let's cover that first.
Okay. All right. So the list you sent me, I'm sure it's not full. It's just few of them that you sent me. Um, we do have most of them. However, even the ones that we don't have, we can get them. Lucky for everybody, in the pharmacy in Albania, sometimes they don't have it like in the physical location, but they do have it at the depot and then they have to just order them and then get them. So that's what I was told. And sometimes it takes a day or two. It's advisable that you have a script, let's say from the previous doctor in US, or the package, the bottle. So for those of you coming from US, have a copy. It's just okay, just a picture, so we know that that's what the doctor prescribed. And lately, I mean, sometimes you can get any medication you need without an actual prescription if you have already current prescription from US. If you do run into difficulties that they're not giving to you, reach out to me and I will help you out. I will send you to the pharmacies that I know they're good, they have the best medications, and they're gonna allow you to have a refill, okay? But it's best if you come from US, bring the actual package you have or script, because it's for your benefit as well. There is going to be written clearly, from the computer what the medication is and how you take it. It's important, the dosage and how you take it. So you don't want to just go to the pharmacy here and say, I take Xanax. Which one? Just give me whichever you have there. No, like we need to know the dosage, how you take it. You take the 0.25, 0.5, etc. Because it's for your own benefit. You don't want to take a 1 milligram and you in US you take 0.25, but the pill looks the same. So in your mind, you're thinking you're taking the same, but actually you're not. So that's why it's best for you coming from US to get that. And from you being here, just get a copy from the CVS or wherever you used to get the medications before, and they will send it to you by the picture, and that's what you present to the pharmacist in Albania. So I reached out to two of the best pharmacists that I work with. Now I work with, I go there to get medications for myself and for my family, just because they're busy. So places that are busy, they always sell a lot. So the medications are good, and the location. So one of them is she's called, her name is Irena, and she's in Lungomare. She's the very first one when Lungomare starts from the town. So when you come from town, she's the very first one in the corner. And I like her because she explains in detail like what the medication is, da, 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 So everybody, when I came to Vlora after a long time, everybody told me to go there. There is another one, it's called Giulio, and that's right in the middle of Lungomare by the gas station, if you guys know, and that's open even a little bit later, like 10, 11 o'clock. So those two are the ones that I know they have good medications, okay?
Can I stop you
Always
for a
make sure
second?
when you read.
Sorry.
Yes,
So not everyone's going to be in Vlor. So do you have suggestions also for Tirana,
yes.
Durrës? Okay.
Yes, I
Okay.
do. Yeah. So, because I live currently in Vlor. So for fear, let's say it's called Pharmacy Nachi, and I can give you guys the phone numbers of this pharmacist because I talk to them often. I send a lot of patients to them. There's so many medications that in US is really hard to get. So I send Albanian patients to get them there. And sometimes it's worth even to travel to Vlora or a Fieri if you have to get the good medication. And you can get it for 3 months, 6 months is okay. But it's worth it, like the money and all that. The reason I like this pharmacy, especially Nachi, the one in Fier, they have medications that you cannot find anywhere else. They always have like these good medications, like for hepatitis, Ozempic, and they do a lot of free health clinic. So they get all the women and they test their vitamins, their bone density, things like that. Like every week, I used to walk by there and I used to see those things, and I like that. I like when you give back to community. So those are pharmacists that they don't just lie to you or increase the price. They care about their patients. Let me put it that way. But I don't want you to buy medications they read like in Albanian, let's say. Not all of them are real, okay? So I want you to get Greek. It's Italy. Italy, Greek should be your first choice. So when you go there and you give them the name, you say, is it from Greece or Italy? Because those are the ones that don't really, they work the best, okay? And I'm talking about the main medication. I'm not talking about those. Those are okay, but I'm talking coding, SRIs, hypertension, diabetes. Those, make sure that the brand is good. Okay, it's from Italy, or Italy, Germany, Greece. Those are the countries that the medication is the best. Okay, so based on 2, 3 pharmacists that I reached out with a medication list, this is what they answered to me. Okay, and you can make notes. So Irena in Vlor, she said that she has levothyroxine and the tadalafil. So these two medications she definitely has. The rest she needs to go and check, if they have it. But then the other pharmacy that I told you in Fear, and again, I only asked two because I didn't have much time. I will continue talking to you on the chat. I will continue searching more pharmacies. I just need to walk there because it's easier to walk and meet the pharmacist and tell them who I am and why I'm asking for. Because in Albania, there is a lot of corruption where they put an investigation and they think I'm the police, so they don't want to text. They're like, just come here with a script. So that's why I need to go to Tirana to get more
Okay.
information. So pharmacy Nachi in Fear. I'm talking to pharmacist. She said she has the Symbicort. She has the liver. Okay, the same thing as the other one, but she also has the Symbicort. So the only ones that we're not hearing bupropion. And I know Wellbutrin is hard to find here. It used to be, but I don't know why they stopped. They used to have it. And then this other one for thyroid are more, I'm sure maybe they have it, but on a different name. And then albuterol, they do have it, but they don't have the albuterol. They have another one that is very close to albuterol and is very good. I'm going to find the exact locations, phone numbers, and the names. So that way you can give it to them, Sarah, exactly what they can order. Um, Also, if you need a doctor from US to prescribe you within US, and I'm coming from America here, I can bring it for you guys. All you have to do is send the medication to my house, and I know I have the package ready, and I bring it to you or my family. Somebody brings it for you. There's no issues. Like if it's medication, everybody says yes to, as long as it has to be with in the package, not outside not open. Okay. And then okay, so this for medications, don't worry, like we can find it either here or in America or in Italy, in Greece. I have connections and people that, even if you really need it, just don't wait for the last minute. So always reach out to me and Sarah and say, look, I'm running out, I only have a week or 10 days. So if we have somebody coming from Greece or from Italy, they can bring it, okay? Because I think I know those states also work like us. It's okay if you don't have a prescription. Usually the pharmacists just give it to you, something that never happens in US, right? So in US system, you have to have a script from the doctor to get the medications, even for antibiotics, even for SSRIs and antipsychotics and benzos. Those are definitely e-script. We don't even give the hard copy script anymore. We have to send it directly with some very safe codes that we have to use to make sure that the doctor is the one sending it. So my advice to you is, since I worked in psychiatry for a long time, I know this trick. We used to give patients, let's say you come to America for 3 months or 6 months and you really need the medications from US. So you tell that to the doctor that, look, I'm leaving for so many months. So what they can do when they write the script, they can say twice a day. Or let's say you're taking paroxetine, the 20 milligrams. So they can put their paroxetine 20 milligrams twice a day. And then, or let's say you're taking it 10 milligrams. So they still give you a prescription for 20 milligrams, but you only take half. And if you take that for 3 months, so you cut it in half, you actually have 6 months supply. That's what I do for my own prescriptions. I always tell the doctor more and I split it in half and I have more just in case if I stay here longer. If you are taking antipsychotic and SSRIs, mental health medications, be careful, okay? As you know, some of them take 6 weeks to work. And then when you stop, the same thing, you have to stop with the doctor, right? You have to winding off. You don't just stop it automatically. Even though you might feel great. Let's say you come to Albania, there is sun, there is social life. You're going to see a big change in your mental health, emotional, psychological. You're going to make friends. You're going to go out. Don't stop. Don't say, look, I don't have anxiety here. I don't need it. I'm going to stop it. You still have to stop with the doctor slowly, slowly, slowly. And what happened is on the first week, second week, we see that you're feeling good. We just reduce it slowly. And some patients, they don't feel good. They say, you know what, doctor, I felt better when I was taking it, the full dosage. So we bring you back to full dosage. We say it's not the time now, we reduce it later. Always keep in mind that most of the manic episodes and all the trauma and the stress and depression happen when patients change the medications on their own. Okay, that's why when you come from America, please bring what you have as long as you can, so when we make that transition to the medications here, is slowly. Usually you have to start a new medication and you slowly stop the one you're taking, right? You give time to the new one, etc. Also, if you're getting pregnant, we need to know, like, the sometimes the medications need to change, or if you're planning to get pregnant. But it's definitely, so you do get help here. If we're going to talk about the difference in healthcare visits and costs, right? So for medications, don't worry about it. We have it all, okay? The ones we don't have, like EpiPen, please bring it from US. It's better, it's safer, A Benadryl, the pink one, please bring it from US. We do have some here, but I like the one from there. And then some other medications that I will tell you to bring it from US, but most of them we do have it, so don't stress out. So now when it comes to visits, right? If you are in US, usually you have insurance, health insurance, and you're going to pay a copay. So in Albania, it's different. The healthcare is free, but there is a little bit of corruption when it comes to, like, you go to the hospital, or if it's private office, they will tell you upfront how much the visit is. So that's good. You only pay the whatever you have to pay there. I'm outside in a village, so that's what this thing is flying behind me. Welcome to Albania. So, but if you are in hospital, let's say, right, the public hospital, you're not required to pay. Okay, so you go there and you admit yourself, and it's free. Healthcare is free in Albania, even for Americans. For everybody, it's free.
So is
So
this for people that don't have a permit as well?
everybody,
Okay.
healthcare is free in the state hospital.
Okay.
However, there is private hospitals. There is Italian private hospitals, German private hospitals, American. In Tirana, there is 3 American private hospitals, right? So if you, let's say, have a little bit of money and you don't mind, and let's say you don't want to wait, you can definitely go to the private hospitals, okay? And I will advise you where to go to make sure that you go to the best ones, you get the best treatment, they speak English, you get everything in English. So I will guide you and advise you. But most of the time, you don't even need to, right? I don't go to private hospitals. I go to state hospitals. So you go there, you admit yourself, you can go to the emergency room, and then you say, this is my name, I live here. They take all your history, your name, last name, and everything. They do your vitals. They do. Let's say if you go there with chest pain, they will do your EKG right away, right, to make sure you're okay. And then they will just put you in the room. Most of the time in Albania, don't be surprised, because in America they don't do this. If you go dehydrated, headache, or anything, right? They will put an IV right away. So I like this, I have both experiences. I have the US experience and I have Albanian experience. I like the experience in Albania because once they put an IV, it's kind of like easy access and fast. Whatever your issue is, right? They can just put the medication on the IV and you get help. But one thing they always give you is fluids, right? So they give you enough fluids. They make sure you're not dehydrated, or if, let's say, you went out to drink the night before, or like whatever the issue is, it helps. People always become better, okay? The only time they don't put an IV is if you have to do a surgery, or, if it's an accident or whatever. But most of the time when we go to the ER, that's the first thing they do. And it's okay. So don't be scared if you go there. They will take your blood immediately, okay? Because the even without you seeing the doctor, sometimes the nurse comes and they know that we have to take the blood, so they do this to save time. By the time they draw your blood and they send it to the lab, maybe the doctor will come in half an hour. So when the doctor comes, they already have the blood results, so they know what's wrong with you, what to give, what not to give, right? So they ask you for the urine in the cup. You just go and you have to give urine in the cup, and always be honest with them, right? Like, whatever happened, whatever, wherever you were, whatever you ate, whatever you drink, alcohol, place you had it, etc., etc. So I know they do have translators almost anywhere you go, but if you live in Tirana, let's say, right? My favorite hospital in Tirana, it's called Shëndroqi, and I'll give you the name and the location. And ER there is the best, because if you go to Mother Teresa Hospital, it's so busy, it's so crazy. You might wait there for so long, and that's why people go to private hospital. So I don't want you to go and have a bad experience. You're already sick, so I don't want you. If it's emergency, I want you to go there. Now, That hospital is specialized for cardiology and pulmonology. So I'm going to tell you a secret that I do. I always tell them I have chest pain, because if you don't, then they don't take you. They say, okay, go to Mother Teresa Hospital. So whatever is wrong with you, just say you have chest pain. They will still help you with vomiting, diarrhea, whatever issue you have with going on. But because of the chest pain, they're going to do an EKG and the cardiologist is going to see you. But what I'm saying is, at least you're going to be taken care in a very good hospital, okay? If you have, let's say, psychiatry, mental health issues, of course, you have to have a psychiatrist at all times in Albania. I do know about three of them because that's my specialty, right? So I always had patients that I had to recommend to them. One of the doctors, she goes to Vlora and Tirana. So it's the same doctor, but she goes in two different locations, which is great. For people living south, they always see her in Vlora. And for people living middle and, north, they see her in Tirana. There is another doctor, his name is Adriano. I wish that these doctors could do online visits, but they don't. They only have to see you in person. Psychiatrists in America, in what is it called? New York, he used to do online visits. So if, let's say, you met with a psychiatrist in Albania, the visit is about $20 because they have to meet you privately, right? So it's about $20. And by the way, for medications, you have to pay, self-pay. For those of you who don't have insurance, health insurance. For those of you who have health insurance, not all of them are reimbursed. So sometimes, don't worry, don't feel bad if you don't have health insurance. Let me put it that way, because you still have to pay for the medications. But they're not very expensive. I think what I see here more expensive are vitamins. Then antibiotics are like $2, $3, $5. So are not so expensive, like, really, compared to US. No, in US, when I don't have insurance, it's like $300, $400. It's crazy. But so the visits are about $20, 20, 30. And then if, let's say, for some reasons you don't like the psychiatrist here and you really feel like it's not doing much, or it's changing a medication, or it's not changing, etc., I can I can make you an appointment with my previous boss in New York, and he can meet you virtually like this. It's just that the location, if you have health insurance in New York, he might take that, definitely. If you don't, it has to be self-pay. Just don't tell him you're in Albania, just say you're in New York, you're in Florida, you're in anywhere in US, and you can have a virtual visit with him once in 6 months or 3 months, just to make sure that the medications you're taking, they're working, and the symptoms you're having or anything like that, it's not, something new, or is the medication causing another effect, etc. So I would always connect you with a doctor in US, and not only psychiatrist, but any kind of doctor you need, a meeting online, let's say, or second opinion. Just let me know, and I can always, find a doctor that would help you with that. Now, hold on, let me go through questions to make sure I'm answering them in order. Um, okay. Yes, okay, so main topics: how the system works, insurance driven, expensive, high, Albania public health care. Okay, so besides the medications, right, Sarah put here something else. How does it work? Let's say some patients have to go through the blood test, and that's recommended every 6 months, every year, right? Because we sometimes we don't feel the disease, but the blood, we can see it on the blood panel. So it's always good to do a preventive care. You do the health preventive care, and then you do the full checkup for the blood test. So those are good because this you can do it in a private clinic. And it depends. Sometimes it's like $30 to $100, but it shouldn't be more than $100. And I will send you some names of the labs that I know they're very good. Like, I know, I brought my family there, and I know they actually do them, because there is some places, be careful where you go. There is some places they don't even do your lab test. They just put there excellent for everything. And I have anemia, for instance. So anywhere in the world I go to do my blood test, anemia shows there. So if I go somewhere and anemia doesn't show, that means they didn't even do it. Okay, it's not a lot of labs like that, but there is few that you need to be careful. So I don't want you to be one of the people that go to these labs. I will give you the names so you know where to go. Um, Again, the cost is about $100. They check your sugar level, lipids, they check liver, kidney, pancreas, it's a full screening. Sometimes you can do like hepatitis, like once, I think once a year, once in 2 years, HIV, hepatitis, all viruses, just, to make sure that like you don't have it. I mean, I did it once when my mom was diagnosed with hepatitis B, because in Albania we don't do the vaccine for hepatitis B. So a lot of people have it, unfortunately, and hepatitis B is transferred sexually as well. So if women had it, then male got it, and so on, and kids got it. So when my mom was diagnosed with it, we all got tested. We didn't have it, but we had to do the vaccine after that. So I think it's recommended. Why not? And it's cheap here. So why don't you do a full screening of everything once? It's okay. Now, when it comes to MRI, CAT scan, bone marrow biopsy, ultrasound, we have all of this. We have the OBGYN doctors, we have the GYN pap test, we have the echogram for the breast, we have the mammography, you know. In fact, in the month of October, mammography is free, but that's for women 45 and up. So if you're young, you don't need it, but you can do the echo. So if you do the echo, it's about $30, and I can give you some places to go to, some doctors. But I would definitely advise you do it at the OBGYN. There is some clinics that they're nurses, and I have nothing against nurses, to be honest, but I don't want a nurse to see my echo. I want a specialist doctor to see my echo. I want that doctor, because whoever's going to do the echo is also going to examine my breast. And you know how our breast is, right? If you see a change, if you see, let's say, the a nipple going inside, or if you see something coming out like a fluid, like yellowish or blood, or if you feel a lump, etc. I feel like a nurse is not really gonna catch to it, but if it's a doctor, OBGYN, they know immediately. Like, even if you're changing in front of him, you'll be like, hold on a second, let me see. So if you're paying the money anyway, why not do it at the right place? I do have one very good one in Fier that I go for myself, and one in Tirana that I go for myself, and both these doctors are the best. I recommend them all the time. Those are my top on the list, and it's worth traveling to them. They do even the one in Tirana is he does like all the what is it called, birth controls as well, the IUDs, and all that. I put my IUD there with him, and I was so happy. I didn't feel a thing. And now that's another thing. He's not supposed to like prescribe you IUD, and the state doesn't allow it, but somehow we got it through the pharmacy. So I know that there's ways that can help you. And it was about 100, I think 120, and it's the 3-year one, no side effects, nothing. So I put it because of my anemia. I didn't want to lose a lot of blood. um like, what I'm trying to say is that I can help you with anything. Okay. So you just let me know what you need, and I'll guide you to the right person. Now, the MRI, CAT scan, bone marrow, echo of the liver, etc. I do know people that do it in the public hospital. The only problem is that when you go to public hospital, you might wait and you need a referral. So the referral means another specialist needs to see you to say, yes, this patient needs the CAT scan because a headache and this and that. uh, so what I do, I don't like going to a public hospital and wait. And if I meet the specialist, I still have to pay him some money under the table or wait a lot. I go straight to the private clinic. So there is private clinic in Albania, in Vlora, Fier, and in Tirana that I can send you to. What I paid for my MRI was 120. For CAT scan was about $90. Again, prices are not set in stones, but I think it's worth it. I mean, we don't do MRI and CAT scan like, don't do it, please, very often. Do it like once in 8 months, a year, or don't do it at all if you don't have to, because MRI is okay, but CAT scan is dangerous. You cannot do so much. So if you have to do an X-ray, that's like $20. Do an X-ray, if let's say you broke your arm, or God forbid, or something happened, don't go straight for MRI, CAT scan. Don't freak out. Like, do an X-ray is okay. because you don't want to get too many rays, okay? Because CAT scan is almost like 200 x-rays. Like imagine how many rays you get. So I don't want you. But the prices are great. I mean, they're not bad at all. $90, 100, 120, and you get it done the same day. It's not that long wait and referral and all. And the doctors there that you, so the same place where the lab is to do the CAT scan and to do the MRI is a specialist reading it to you and telling you what's wrong immediately. So that's why it's a win-win kind of one trip, you're done. Uh, so how easy they are easy to get done. They are available again the same day. Sometimes they might do the next day if let's say they have to do it with contrast and you drank something you're not supposed to or you ate something not supposed to, they might say come back tomorrow. Like that's about it. But and also the ones with contrast, because I did about 3 last year, make sure you drink a lot of fluid afterwards because the contrast they put into you, it makes you like thirsty afterwards. So I had that issue for myself. You don't want to get in trouble, but I do it just for fast service, and they like it. Even the nurses, you give them $5, no problem. They will put your IV fast or take it out or give you a little bit more care because their salary is like 500 a month, $500. So that's why it's okay to do that. For now, I think it's okay. Um, okay, so the doctors are all specialized, certified, and licensed. So there's no way that you can he can call himself doctor, be in a medical setting, be in a hospital, and not be your doctor. So that's definitely something that I've never seen before in Albania. It can be, um, and they are trained, they are specialized. Um, the technology is not like in US. So in some hospitals, yes, it's okay. In some hospitals, you're gonna see that very simple beds, but they are clean. You're gonna see very simple like the blood pressure cuff, let's say, So, but just always know that the quality of care is great, even though it might not look great like as a picture when you see the hospital, some of the hospitals, but people working there are great and you're in good hands, know that. um, so where Albanians and experts go for more advanced care, so they go to Italy, Greece, and Turkey. My first option would be Greece because you don't have to fly. You can go there like $50 on a bus or even $30. You can go to Greece, and then so whatever procedure you need done, it's easier to travel by car or bus or taxi than to take a plane. So that's the only reason why I choose Greece over Italy. But as far as doctors, they're both the best. And to be honest with you, because I'm a very honest person, my doctors in America are from Greece, Italy, Turkey, Albanian, because it's not that I have anything against like Pakistani or India, but I just like how they're patient centered. When I go there, they don't rush me, they don't look at the time, they don't look at how much medication they're going to prescribe and make money. They're more of like what you need, they listen to me, they care about me, and that's why coming to Albania, I rather, if you need something that, let's say, you cannot get it done in Albania, or you met the doctor, you don't like it, or God knows what, then Greece, it's my first option, and then Italy. Third, Turkey is the third. In Turkey, they go a lot for, God forbid, cancer. A lot of cancer patients, they go there, and a lot of patients they want to, they do the hair transplant. They go there. Okay, plastic surgery. A lot of them, plastic surgery. They do it in Tirana, where Italian doctors come here. So that's good. Okay, but I know all doctors. Whatever you need, reach out to me. I'll help you out. Emergency and preventive care, emergency response, ambulance system. So always know the 112, that's the ambulance system. You always have to call. They come and get you wherever you are. Make sure you're calling from an Albanian number, and tell them where you are, and ask an Albanian to talk to them. So let's say you are somewhere and you don't know the language, you don't know how to explain to them where they are. just say help, talk to ambulance. Ambulance, we say ambulanza. It's almost the same. Ambulanza, ambulanza. And they'll call for you. Usually Albanian people, for those of you who are in America, Albanians are very helpful. They love to help, they love to be the heroes everywhere. So you're always going to be safe. But again, um,
Can I clarify
follow,
something real quick?
yes,
So for the people that aren't here yet, a lot of the towns here don't really have addresses. So it's not like you call 112 and then you're like, I'm at 13, Brick Road. So that's why you have to kind of explain where you are. Or like if you're next to a restaurant, you say I'm next to the restaurant or, something like that. That's why you can't just give your address like that, like it is in the United States.
yes, true. They are making some roads and some numbers, but there used to be less houses. That's why they never, put the numbers there. And now it's a big mess of they don't know where to put the numbers. But it's easy to find, like Sarah said, if an Albanian is with you and they explain to you or a neighbor, and come into Albania, be friendly. Like it's okay to make friends. Know who your neighbor is. Talk to them because you never know how they're gonna help you or when they're gonna help you. You can ask them, etc. But also be careful, choose your people. You don't want to come and be like, oh, look, it's my first time here. And I mean, there is good and bad people everywhere, but always be cautious of how much you're telling to until you know the place and you know everything else. Because not everybody's going to have good intention. Who knows? Maybe somebody's, I don't want to scare you, but like broke or drug addict. You don't want to go out there and be like, hey, I just came here. I don't know anything. Let's be friends. I'll show you my house. No, no, no. Like, take your time, make friends first. But most of the places are safe and people are nice.
Need to know if you can get Wegovy over there or in Greece or Italy.
OB?
Wegovy. Weight loss, Wegovy.
Oh yeah, that's like the
Oh,
Ozempic, right?
It's like Ozempic,
okay.
yeah. It's real
Okay.
popular here in the US.
Okay. So I know there is some weight loss shots that they're doing here. I am familiar with Ozempic that Nachi Pharmacy, one of the pharmacy has it. One of the pharmacy friend of mine back in US, she told me about the side effects and why they don't recommend it. But she also told me that the doctors in US are doing it wrong. They're doing kind of high dosage and they're doing the same dosage every month and patients are liking it, they're losing weight, but she said it's wrong. So what she advised me, if I'm going to have patients to give it to, even though I don't, she said, start with a low dose and then you keep increasing it, increasing it, increasing it, and then you start decreasing it, decreasing it, decreasing it. And then you give time off to the patient and you start again. Because this medication is meant for diabetic patients, not for weight loss. So if you give a medication to a patient that it's not supposed to be for, that purpose, it's going to affect the pancreas and then you're going to have a bigger issue later on, that you didn't need to have. So be careful with your
Dose. I'm on the 0.25. I'm on the lowest dose.
excellent,
This is my
excellent,
second month, and my third month will be on the lowest dose. And then my
excellent,
endocrinologist will, I don't
excellent.
know.
Okay, great. So if you're on the lower dose, that definitely doable
Right.
because you see how you feel. So also Albania is going to make you lose weight naturally because it has organic food,
Yeah.
So you're going to move a lot. People walk here a lot. It's like you're going to have a change of lifestyle, right? In
I'm looking
America,
to it.
yeah, so I have a PhD in public health, and my PhD dissertation was based on why Albanians' health changed 5 years after moving to US. And the conclusion was because we don't move there as much. There is lack of organic food. I mean, let's be honest, America doesn't have enough organic food, even if they want to. Like the population is so big that we cannot
It's
have for
very
everybody.
expensive.
And then here, Sarah can tell you, like you go to villages that are so close and you get these fruits from the trees, even allergies, you don't have as many as in US. So there is plenty of organic food. You just have to go get it. Like don't go to the big supermarkets. They're expensive. And sometimes, yeah, you're gonna find food with hormones here as well. But me, I like to go to places that I know it's from the village. And you can see some of the fruits, they're already like kind of ugly. They're not that perfect looking. So you know that that's the organic
Right.
one. And when you taste that green salad and tomatoes, and you're going to have plenty of that, and you're going to start losing weight like naturally. Albania, it's meant for people to lose weight. So,
Yeah.
Yes, it's sunny, you know. So you're gonna get the vitamin D. So the metabolism is faster, and you're gonna keep eating organic, and you're gonna keep walking. And because you're gonna have a social life, you're gonna have friends. You're always gonna be out walking. So I felt like in America, I was in New England area, Connecticut, New York, New Jersey, and I was always hungry. I was cold. I was always going to the fridge, and I'm an emotional eater. So every time I get upset or sad or I saw people eating or I smelled food, I wanted food. But in Albania, it's the opposite. My mom is like, come eat. And I said, no. My aunt right now, she said, are you done? Like, we're going to have dinner. I'm not even hungry. It's 8 o'clock. So here, life, it's different because you work, but you also go out, you make friends, you walk, and it's so busy that you forget to eat, and you're only going to eat um by hour, so on the schedule. And if you eat on the schedule, let's say you have breakfast at 9, and then you have lunch at 12, and then you have dinner at 5 or 6, when you eat on the schedule, you're going to start losing weight because the body already is going to know when you're going to eat, and the stomach is going to start shrinking because you're going to eat organic food all the time, and you're going to feel better, and the stomach is going to, you're going to eat less, and you're going to see that by walking you might not see it on the scale a big change, but your body is going to be tonified, and then you are going to feel stronger, more energetic. One thing in Albania is I have more energy. I sleep less, I have more energy, I wake up happy, I look forward to what my day is like, what I'm going to be doing. So that's what I'm saying. I can connect you with a pharmacy in Albania. She did tell me about the prices. They started at like 200 for the shot. She was telling me they're expensive. But I don't know if it's 2 weeks or if it's 1 month. So you can talk to her, directly and say which one, which dose. Because I think I was asking her for a higher dose one time. So make sure that, you have the same dose, or you have a picture of the script, and then she can definitely give you the good one. Also, for some patients that are using Ozempic and different shots, like I said, one of the jobs I have right now, it's called SNAP. It's from Italy. It's for weight loss, 100% organic supplements. So if you are coming to Albania and you need a second job or just something extra on the side, I always say to people, buy it for yourself first. You're gonna love it. You're gonna try it. You're gonna feel good. And why not advertise it to other people? I just had a conference in Toscana because I was one of the 30 best people to sell it for the summertime. And they said to me within 3 years, they're bringing it to America. It's something like Herbalife, but it's better because it's 100% organic. And if it doesn't work, people return it, they get the money back. So this is something for you to keep in mind, whether you want to use it for detox or you want to work and make some extra money. Why not? Um, and does anyone else have any questions?
I do know, I would like to add to, I know a few expats in Vlora and they've lost at least 20 pounds just by walking around, and because Vlora has that lovely promenade, so everyone's always
Yes.
walking. But I
Yes.
do know another expat that goes to England every 3 months to get Ozempic, but I don't know the price. I just know that she told me that it's cheaper to take the flight to England, get the Ozempic there, whatever, other brand in that way. She gets it there and then she comes back and it's still cheaper than the US.
Oh,
But yeah,
yes.
it's,
US was like 800, I think.
yeah.
Yeah, 800. The Albania lady, the pharmacist here told me 200. I was happy. But then I don't know, I just referred somebody to her. So I can ask in Tirana as well. Where is the couple gonna be leaving? The couple that had the question. In Tirana or Vlora?
Eh.
Uh,
Okay.
we don't know. We're coming the end of November to try to figure out where we want to live.
Okay. Okay.
At this point, we're thinking Saranda, um, Valor area. We're in
You
Florida.
like the beach. You like the beach.
We live in Florida.
Okay, great. Yeah, I was in Florida in Tampa and Palm
I
Harbor.
have seasonal effectiveness disorder, so I have to have sun. And not necessarily warmth, but I have to have sun.
Then you
So
come into the right place because Albania has sun, so much sun, but we do have 4 seasons. So even though it's going to be winter time and it's going to be cold, but you're going to get that sun, that that you need, and that feeling of that. Um,
even up north, like in Tirana and Pogodrak and
so yeah, so we do have, I'm not sure how many sunny days, but I know it's more than like 300 sunny days. So that's what I love about Albania. that we
Okay.
do have sun, but we do have the four seasons. So even during okay, uh,
No
AD
snow.
no, snow, you have to go all the way north to get
Okay,
that.
cool.
Yeah. So, which is fun once in a while to do it. But if you stay in Vlora, it's never snow. It's never cold. The only thing that Vlora has, it's quiet during winter. So I'm not sure whether you want like you know how many. So the first thing is rent. Don't buy when you first come, because if
No.
you rent, you can rent is cheap. So you can find rent in Vlora for 100, 200, or 300 is what I'm renting by the beach, like right at the beach is $300 a month. And then
In-
Tirana in Vlora
in-
is 300, yeah, 400, right, Sarah? Sarah can
Um,
she can.
I'm sure, you know, you're paying the Albanian price.
No,
You can,
I can.
it's still very, like, I actually just looked at an apartment today and it's like not even 5 minutes away from the start of the promenade and it's 350. It's a one bedroom, one bathroom, totally furnished. You know, my first place, I had a view of the bay and it was two bedroom, two bath, and that was 300 euros. But you have to, because the problem is or any foreigner comes here and they think the price that maybe some, you know, crooked
Okay, so
realtor says is good, and they think it is because it would be in the US, but actually here it's like outrageous the price. But if you look and you go with the right realtor, you can absolutely find places 300. Even like I did see a place the other day that was 170 euros. It wasn't furnished, but sometimes people do actually prefer it unfurnished. So
yeah,
if you go through the right people, you can definitely find,
Who
yeah, in
is
that
the
price
okay.
right
range.
realtor? How do we,
Well,
I'm reading about all these scammers.
yes, I'm gonna actually do another info session on that with a realtor, so we'll cover that. But also,
Yeah.
sorry, can we go over? I had a lot of questions about the ADHD.
Yeah, I see.
Yeah,
So they do not have the ADHD medications here, because I've asked pharmacists before. I need to ask in Tirana if I can find. It's just the state doesn't allow it. So it's almost like Albanian, minister doesn't believe in ADHD, so they don't think that patients need medications for ADHD, and so Adderall and all these amphetamines, I would say take it from US, and maybe ask the doctor, like I said before, to prescribe it twice a day, increase the dosage, and then you can, when you're here, take it only, half of the dose. But again, Adderall, amphetamine, always make sure you take it like as needed. It's not something that you should take every single day. If you are working Monday to Friday, so take it Monday to Friday, and then so don't take it after like 2 o'clock, okay? And then don't take it on Saturday, Sunday when you don't need it. So this way, let's say you're not working Saturday, Sunday, and then this way you give body time to clean and detox from it, and then Monday it works. Because if you keep taking Adderall every day, it's going to develop tolerance, and then one day it's going to stop working, so you need to increase the dosage. And Sarah can tell you, in Albania you don't need it as much because you have so many other distractions here, that so many people, they reduce the medication until they stop them completely. Okay, so bring as much as you can, just in case if you need it. But please, when you are in Albania, take it only if you need it, as needed, so that way, you can slowly, reduce it and take it on the days you really need to be focused and need to get the work done, whatever job you're doing, or
and
so
Greece and
it says,
Italy, they don't have that as either.
um I, I can ask to make sure, but your other option, like I said, is to have a meeting with a psychiatrist in US, and maybe the online meeting, and if they allow it, to send it to somebody's house, and then they mail it to me and I bring it to you. But again, it has to be with a script and all that, because I don't want to be responsible for anything that it's not with a script and
Yeah.
it's not fully closed. I cannot take it. But
Okay.
somebody can mail it, or we can find a different option. um but I can ask for Italy and Greece, okay? Or I'm gonna see whether they have it in Tirana. I haven't asked in Tirana. I asked in Vlore and Fier, but you didn't put it on the list, to be honest. I don't think I saw it on the list,
I don't.
and I didn't.
Nobody asked, but
Okay, so
they
I'll
tell.
ask.
Yeah. Yeah.
I'll ask. It's okay. So, treatment for lupus, I have to ask. Narcotics for chronic pain. Yes, we do have this in toxicology in in Tirana. There is a big hospital there. I can show you behind Mother Teresa. You go to the third floor, and it's called a toxicology place where you go there and they give you medication for detox and hydrocodone and all that. Also, psychiatry in Albania is different. I just want to let you guys know in case you have friends and family in America, and it's my dream actually to have this hospital in the future. So in Albania, different from America, the law is if somebody's having a mental breakdown, manic episode, it's simply on drugs, right? The family or the wife or the husband or somebody, family member, has the right to take this patient to the hospital and hospitalize them and sign for them and say, do not release them until they're fully recovered. So that's a good thing because so many Albanian patients, I brought them to Albania only for this reason. Because in America, if we bring them to the psychiatry unit and they sign after 2 days, I want to get out, and they're out. It's nothing we can do. If they want to hurt themselves, hurt somebody else, if they're having manic episode, unfortunately, the patient's right in America. But us in psychiatry, we suffer from that because how can a patient that doesn't know where he is or what under influence they are on make decisions for themselves? They can't. And of course, they hate the hospital, but they're harming themselves and others. So that's why in Albania, they don't do that. Even if they see a person walking on the street that's not mentally okay, they hospitalize them. So this is just for something to keep in mind, that if you know anybody and they're not feeling well or whatever, they get the mental help by going to the hospital. There is a big psychiatric hospital in Vlorë. There is one in Tirana. There is one in it used to be one in Fier, I think, that closed down. But there is very good hospitals that they help those kind of patients. Treatment for abdominal migraines and nausea. Yeah, we have all of this. The pharmacy has all of this. Omeprazole, yeah, we do have all of that. Possible to get a blood panel here similar to Medicare? Yes. Yes, like I said before, it's about $100 and you do get all of that. All the tests are done here and they're easy to get done. Don't worry. There was another question I think I missed
Yeah,
before.
estrogen patches, when will they be available?
Okay, so I'm not sure if they have that. I know they do have the IUD that I told you, but for the estrogen, so is there any way you can send me all these questions that I don't have the answer?
Yes, I will.
Because I'm gonna give you the doctor's names and numbers as well. But since some of them don't speak English, I kind of have to be the middle person to make you guys appointment. But like I said, even the GYN, the pap smear exam, I think it's about $40 the lab and maybe $20-$30 the test itself. So by $80 you get it done, and they send the results by WhatsApp right away, like the next day or next week when they get them done. The same thing for blood tests. So when you go there, make sure you give them phone number of the WhatsApp. So you don't need to come back to the lab. They just send it to you. And you always keep the copy, because in 6 months, in a year, you want to do it again, you can see the difference, right? How was it done? And then what has changed. So my dream is to really have a big clinic one day with all these great doctors that, they're patient-centered and not there for the money, and have people from all over the world to come, even like a retreatment, for a week, for 2 weeks, detox and therapy. And there is so much because I love the country, right? So it's the best country to do it, and why not? But that's something in the future. And who knows, if I get Americans, I do have some friends. Like I have a friend in real estate. She works for Seherans, owning Manhattan, the big show, and she wants to do real estate in Albania because she told me, she said, I don't understand how this realtors don't answer the phone, or they change the numbers, or they because they see foreigners, they try to make more money, etc. So I appreciate Sarah taking her time and making sure. But like I said, ask Sarah for help. Sarah can ask me and other people. I can even go rent for you guys and be like, hey, the apartment is for me. I'm Albanian, So they don't know that it's, of course, you have to sign the contract and all that, but you get it with the Albanian price. That's what I'm saying. You should not pay a penny more. Like, no, we appreciate you guys coming to Albania. We love you guys coming to Albania. You're a great asset coming to Albania. We want you to feel safe. We want you to feel just like Albanians feel, welcome and loved. And you don't have to pay a penny more. Like, how would we feel if we came to America like I did 20 years ago, and I was paying more and different. Like that's discrimination. That's racism. That's, I don't know, that's ugly. So I didn't get that. I came to America. I felt welcomed. I felt loved. I finished 4 universities. I made America my home. So I want you guys to feel the same and even more welcome. So that's why if you ever have any doubt, any wariness, anybody does injustice, I was almost one of the person in the big political party here, but I changed because of some reasons. I can still be, but anyway, so I have the number of the prime minister, I have the number of the all police officers, the main people. So anywhere you go in Albania, you need help, please reach out to me. The police would be there, the big guys would be there, they will help you. I know people, I just want you to feel safe and love Albania and enjoy Albania to the max. Um, uh, um, be safe, ask Sarah, ask me, try to make good friends and good connections. So that's my thing. Based on your job or where you live, if I know the location where you are, I can have some connection and introduce you to the good people. So that's what I meant to say. Somebody texted another thing. Okay, how hard it is to get in with the toxicology department in America? There is so many steps to even get in with a doctor, much less get the medication. Do we need referrals? You know what? I will. So there is this big private group that they do help people a lot with therapy and mentoring and all that, but they told me they don't give the medication. So I'm going to get in touch with the doctors in toxicology department in Tirana and get you more information on how to how to go there, make an appointment and do all that. um I don't know it yet. I saw it when I went there with my dad. He had the prostate examination. So the doctor doing the prostate examination was right next to toxicology. And then I saw the toxicology and I saw the doctors and I saw the patients coming, getting the medications and leaving. But to be honest, mental health in Albania, it's a stigma that people don't talk about it. People don't, they're shy to tell me since I'm a public figure. So that's the reason why I don't know much about it, because they don't come to me directly. They try to find it. So I will find out more and definitely let you know, and let Sarah know so she can express to everybody. Because the reason why I have so many resources, I have about 1 million followers. So one post I make, everybody reaches out to me. But I want to make sure that I bring you to the right direction, right people. I don't want you just to, even if you're buying a house, let's say, or doing something big, reach out to us, ask for an opinion and say, this is what these people are asking for. Is this the good price? Is this the good, one time I went to the embassy of America. I went to do something, American embassy in Tirana, and the police outside the embassy asked me for the passport and I gave it to him, and my sister screamed at me. She said, you don't give him the passport. Like, who is he? He's nobody. It's the police outside. You give it only inside the embassy. And I said, why is this big deal? And she said to me, it is because they can make photocopies and God knows what they can be doing with that passport. I said, I'm sorry. Living in America for 20 years, I trust people and I feel like they're doing the right thing. But be careful, always ask Sarah, ask me, ask other people, because we can tell you more, just to make sure that you don't fall on the wrong crowd. We don't want you to have a bad experience. We want you to have the best experience, to like it, to love it, and to enjoy it. But after a few months, you're going to be like us here, giving lectures to others.
It's true. It's true. Okay, let's do one last question. I've had abnormal pap smears for most of my life. Do you see that one?
Oh, okay. So no, I just saw it right now. So, Briseida, how can we contact you? So Sarah is gonna give you my WhatsApp. I can also write it here. So it's +1 because it's a US number, 860-712-3161. And I can send you my social media. So my Instagram is Dr. Briseida.
She's also she's already in our Americans group as well, everyone, just so you know.
Yes, I'm on Facebook. I don't see it much, the post. I'm
Yeah, it's
sorry if
okay.
I'm not
It's all
very
right.
active there. But sometimes when I see a question or something, I try to help. Okay, so okay, we did this one. Um, so I've had abnormal pap smear for most of my life, necessitating colonoscopies, okay, and biopsies. Can I get this care in Albania? Yes. So let's say in Fear, we have a Turkish hospital that I also needed something done when I came from America because I had internal bleeding, and they took me in the same day. I paid $30 because it's a private hospital, so you have to pay something, right? I paid only $30. It was considered as a referral, but so because of the pap smear, it depends if you're living in Tirana or in Fier. Like I said, if you're up, if you're in the center, Tirana, or if you come here, let me know which of the doctors I sent you to. They're gonna do the pap smear. And then for colonoscopy, you have to go to the GI doctor, which I do have a doctor in Tirana and I do have a doctor in Fier, the same hospital I went to.
No,
They are
not
like,
colonoscopy, colposcopy.
oh, sorry. Okay. So can you tell me a little bit more?
Colposcopy, so that's just when they stick a camera into your vagina and look at your cervix and
Okay.
whatnot. And lots of
Okay.
times they take
So the same
biopsies.
thing. It's the OBGYN that will do this in Tirana.
Okay, so
Because
I can get that treatment
oh,
there.
yes. Yes,
Okay.
definitely. Biopsy, yeah. So the same doctor that I go to, he saved both my aunts from cancer, cervical cancer. And he's great. He's the best. A lot of them are very, very good doctors. But his mom was also OBGYN. So when I went to his private office, I also met the mom. And those are doctors that are patient care. They love their patients, so they will take care of you. And if you go to the hospital, it's free. But if you go to the private office, you might pay $20, $30. And sometimes I go to the private office just because of the wait. I don't want to go to a hospital and have to wait so long when I go to his private office and he has the same, equipment there. Unless he tells you, let's say you go to the private office, and I can forward the names as well to Sarah, and Sarah will give it to you. When you go to private office, he will do the pap smear, he will do the test and all that, and he might tell you that, look, for biopsy, biopsy, it's a more complicated procedure. You might have to go to hospital. So he would make you an appointment and say, for biopsy, you're coming to the hospital, on this date. So when you go to the hospital, you make sure you have the doctor's note saying that you're there for Dr. Let's say Rezar Tayaz is his name. Because sometimes at the hospital, there is so many people. And, since it's free healthcare, so many people wait in line. They're not really respectful to the doctors. They see the doctor as like, you work for me, like, come on. But if you go there with a script, you say, I do have an appointment with the doctor, like I need to see the doctor. And always keep the doctor's WhatsApp number. That's why I have their WhatsApp. So I tell the doctor, hey, I'm here, and he'll come and get you at the door. Yeah.
Okay, thank you so much. I don't want to keep you any longer. We appreciate this.
Yeah, you're welcome. Any more questions, anybody? What is the job? I see 11 people here. What's what's your job, or what's your, how would I say it? What are you looking for in Albania that I can guide you to the right people? Like, what's your job gonna be, or your place you want to stay, or what are you looking to get the most? So I know, to guide you some right direction.
I think for
Anybody?
the most part, these people are all they're not really here yet. It's more of like, okay, is Albania really for me? And they're exploring their options right now.
Okay, great.
Oh,
So
Anastasia. Anastasia's here already in Vlor.
okay, great. So perfect. Great, yeah. So I'm trying to be a companion for the older expat in Laura. Okay. Yeah, so if you ever need a job, or if you need to convert your diplomas, there is e-Albania you sign up for. And also when you come from America, make sure you bring all the documents you need. So when you open a bank account here, for instance, they do need your like certificate. They asked me for my birth certificate, and then the American passport. And if you can get the Albanian passport, Sarah might know that. How long do you have to live here or work to get that paper, Sarah?
You have to be here for 7 years, and then you can apply for permanent residency, and then you need to take a test, and you do need to know the Albanian language.
Oh,
And
really?
that, yeah,
Like,
yeah.
okay.
I heard
Well,
the test is pretty basic,
yeah,
but
yeah, sure. Okay. But if, let's say, you come the first year and you really love it, that's something you should look for, like, why not? But with American passport, you're safe. With the license, driver license, you're safe. Did you need to convert the Albanian license living here for long, Sarah?
No, well, so if you buy a car, then in theory you need to convert it by a certain amount of time after it's passed. But I know a few Americans that never did it, and it's never an issue. I rent
Okay.
cars here occasionally, and
Okay,
sometimes I'll
great.
get stopped, and I just start speaking English, and the cops are like, "Okay, go."
Of course,
So
yeah, they're welcome. So also one more thing, you can ship your cars and your things from US as well, and they're not very expensive. You can pay like $900 to ship your car. So if you want to do that, you don't want to sell your car there, you ship it. Takes about 6 weeks to get it here. I do have contact in US for you to ship them with a really good company. Please don't use any scammers there as well. There is scammers, unfortunately, in New York, New Jersey. I can give you contact with the good people that I ship all the time my stuff. And I also know people in Dur. So when your container comes or your car comes, contact me. I give you the people's name, so you go and get it straight at the port. It doesn't have to go sometimes through customs and for you to pay an arm and a leg. You just pay $50 to the guy and he will let you out. And not for the car. The car is about 900, or I don't know, the car it's 900 to ship, and maybe it's 300-400 to clear from customs. But I'm talking about clothes and other things, that like there is ways to go around it, but you can ship your own things if you want. Especially clothes, they're more like they're better from US. I think the prices are better, I always bring from US. There are some here, but I don't know, I keep changing them. I like the brand from US. What else? Oh, try to eat olive oil. Drink olive oil when you come here. Get the original one, the organic. Olive oil is the best for you. It will heal your body. So 1 spoon of olive oil in the morning. Try lots of fruits, vegetables. If you want fresh meat, Sarah can tell you where to get it. There is these butchers guys that have these small stores. You go and get it fresh every day. Don't go to this supermarket to get the frozen ones. You don't know what you're getting. Also in Vlor and some villages too, you can get the fresh milk. So from the cow. Don't focus so much into like this Erzeni and all this on the store, on the market. I don't like the big stores, the big supermarkets. I like where villagers are because you get directly fresh. What else? Be safe. Enjoy Albania. I'm here. I gave you my number already, my WhatsApp. If you need appointments with me, just please 2-3 days in advance, just because, fully booked. We can plan another phone call like this and let me know what information you need about the doctors, medications, and I'll respond to you. But please don't be scared. You're coming to the right place and enjoy it, enjoy Albania. Like, just, I know so many other Americans, they are in Tirana, but they're not part of the group. And I asked them why they're not, because they're influencers on social media. And they said, well, we don't want to just hang out with the American community. And I said, no, that's not, what this
no,
community is
that's not what
for.
it
It's
is.
about,
Yeah.
exactly. I said, it's about giving information and helping each other a lot. So I'm trying to bring them in, and I will try. But I ask them because I'm very curious. And I say, well, you've been to Albania for 3 years. What do you think? And they love it. Okay. So there's so many people that coming here, they love it. So you're doing the right thing. Don't be scared. Okay, America, it's always there. You can always go back. Just like me, we can always go back. But come to Albania, have some fun first.
Yeah. All right. Thank you so much. I'll connect with you later. And thank you for everyone for joining us. All right. Bye,
You're
everybody.
welcome. Bye,
Bye.
everybody.
Thank you.
Bye
You
bye.